So the liver, right here, underneath our right ribs, the right hypochondriac area. Hypochondriac below the ribs. It's old school use of words. So the liver, one of its number one things is that it smooths the flow of qi in the body. This means that the movement of qi for everything to function normally relies on the liver and its ability to keep that flowing smoothly. So when the liver qi is not flowing smoothly, we call it liver qi stagnation, which is not here, but it'll be here later. So think about that. When the liver qi isn't flowing smoothly, everything else in the body could potentially go awry. There can be problems. We talked about this last week, but what's the number one thing that affects the flow of liver qi? Anybody remember? That affects the flow of liver qi. Stress. Good job, Benson. Stress. The more stressed we are, the more the liver qi gets stuck, and then the more we get qi issues in other places of the body, qi movement issues.
When you say stress, do you mean stress by disease, like stress in the body, or like emotional stress?
Emotional stress mostly, but when you have disease, if you have a mental component, then there's that. And it's not just like stress, like, oh, I gotta commute, that's stressful. It is that, but it's also the stress of various emotions. Yeah. Pay attention sometimes. I don't know if any of you have noticed this, but underneath the ribs on either side, because in Chinese medicine, the liver is not just considered on the right side, it's considered on both sides energetically. Anybody ever notice like a little bit of distension or like tightness or pain here, especially when you get stressed? Yeah? Got a couple nods, 3 nods. At first, when I was learning about this when I was first in school, I was like, oh yeah, but okay, cool. Thanks for teaching that to me. Maybe I'll see it somewhere. I never experienced that. And then I started noticing, especially like on long commutes, I'd be like, oh my God, oh yeah, I'm starting to have a little bit of distension and pain right here underneath my ribs. So there's a lot of symptoms that we just don't pay attention to. But then as you become aware of them and taught them in Chinese medicine, you start to see like, oh yeah, I know that one. Oh yeah, oh look at that, I got that too. Right? We become this wonderful learning ground for this education. The other thing that the liver does is it stores the blood. It does not store qi, it just moves qi. It stores the blood. When the liver blood is deficient, several things can be affected. The number one thing is menstruation in women. So during the menstrual cycle, the liver will release blood into the menstrual flow. Kidneys are also involved in that. Remember last week we talked about the kidney essence, right? So the kidneys will release a little bit of kidney essence into that menstrual flow. Yeah. But the other thing that can happen is based on this physiology. Here's the physiology first. At nighttime, the blood will come back to the liver. The liver will store it more. During the day, the liver will send it out more. Benson, what are you going to say?
So how important it is for the blood to cool off the liver and around that time? Is it so critical or it's not?
When we talk about cooling the liver down, we're talking about the yin functioning, and blood is yin, but yin is the component within the blood. Yeah. Well, we'll talk about warming and heating. Sure, we can talk about that in a little bit. So at nighttime, who here gets calf spasms or has ever had a calf spasm? You wake up in the middle of the night, you're like, oh my God. Okay? So yeah, they're so awful. It happened to me 2 weeks ago. For the first time in years. It's like, oh no, my liver blood is deficient. Because what's going on is there's not enough blood in the liver, so more blood comes back into the liver, and there's not enough to nourish, in this case, the sinews or the tendons. So the tendons are directly related to the liver. So that liver blood is nourishing those tendons. And like we said with the pancreas is nourishing the muscle itself. Tendons are the ends of the muscles that connect to the bone. Okay. So not enough blood there, then the tendons spasm and you get calf spasms. And in terms of the spirits, like last week, it houses the hun, which is related to our past lives, the wisdom that we bring in. And at nighttime when we're dreaming, it goes out to find visions. In terms of warming or cooling the liver tends to run hot in general, tends to run hot. It's much more common. You don't really get a cold liver, but there is talk, some people talk a little bit here and there about liver yang deficiency. Remember, yang is warming. If the yang's deficient, you'll be cold, right? From last week. Yang is warming. If you don't have enough yang, you have more yin. So yin is the cooling aspect, yang is the warming. So if you have relatively more yin, you're more cold. And that's like a lack of drive. A lack of, remember, one of the things, the emotions of the liver is to like push forward and work towards things, and you have obstacles and it breaks through and it keeps working. But that's not as common. The only time I've heard about that is when you use herbs that cool the liver too much. Like you go too far.
Like what kind of,
What kind of herbs? An herb called long dan sao is a very common liver cooling herb.
isn't that something of bile?
What's that?
No, never mind.
Okay. Long dan sao. So what's more common is that the liver gets hot. And that's usually because there's an excessive fire. We talked about excess versus deficiency last week. An excessive fire, liver fire. That's when they have like a big, bright red face. They get super angry super easily. The eyes are super red. It's really like big and excessive. Okay? But that's acute. Then more long-term is a liver yin deficiency. When you're yin deficient, you have relatively more yang, so you are more hot or cold? Hot. Good. So with liver yin deficiency, then you get those mild symptoms of getting angry easily. Your eyes get red, but not as red. Your eyes get dry because the yin isn't moistening. Right? It's especially worse at nighttime. We'll talk about that when we talk about yin and yang deficiency in general. So in general, you want to keep the liver cool much more commonly. Like 95% of the time, you're focusing on cooling it.